Hello, everyone. Welcome to this presentation on broaching, increasing comfort and exploring race in integrative health settings. I'd like to thank you for joining me today, and I hope by the end of this presentation you have some new strategies and skills as to how to broach race, ethnicity, and culture. A little bit about my background. I am a licensed psychologist, speaker, trainer, author, and also a clinical assistant professor at University of North Dakota. I share that information because whether I'm teaching or training or engaged in my own clinical work, I believe it is essential to address issues of race, ethnicity, and culture when working with clients and patients in mental health as well as physical health settings. We can't really effectively treat individuals until we really understand and embrace the various identities that they bring with them into their healthcare setting and healthcare services. So we have to really understand our clients in a totality in order to effectively treat them. A little bit more about myself. I am also a member of the Michigan Board of Psychology, which is a position that was appointed by the governor of the state of Michigan. And I was awarded in 2022 the honor of being the Distinguished Psychologist for the Michigan Psychological Association. So that's just a little bit about me. Hopefully, as we move forward and as we engage in this presentation, you'll learn more about my approaches to broaching. So first of all, what is broaching? Broaching, it comes from a scholar, Devine. She writes a lot about this topic area. So you'll see the word counselor or therapist used a lot, but the term broaching is most definitely applicable to integrative health settings. So when we think about broaching, it really is the providers being deliberate about and intentional about their effort to address race, ethnicity, and culture of the patient. And is looking at the impact of these identities on the patient's presenting concerns. An example of a broach may be a medical provider asking a question. Could you describe what messages you may have been given regarding seeing a primary care doctor? Because in some communities, for example, African American communities, there may be stigma or negative messages about seeking out help because of how Black Americans and other populations of color have been treated by providers. And so asking them, like, what messages have you been giving about seeing me today may be a key question in helping the client to or patient start to talk about issues of race, ethnicity, and culture and bringing their total self into the room, which is important because then that may help you to conceptualize the individual that you're working with better. The benefits of broaching is that it allows the patients to make connections between their racial issues and their presenting problems of what brings them in to see you. It also gives the patient permission to talk about taboo issues such as race in a safe counseling or mental health or physical health dyad. And again, the terms that I'm using are from the counseling literature. The term broaching is often cited within the counseling literature. So when you see counseling, think integrative health. Also, broaching, it allows for the individual to have a catharsis where that can allow the individual to move forward with effectively problem solving and gaining insight and introspection into their presenting issues. For example, going back to the broach that I first presented you all with, that asks, tell me about the messages that you have about seeking out primary care services or working with a primary care doctor. That may help the individual gain insight into some of the stigma or some of the resistance that they have about seeking help for a physical ailment or even a mental health ailment. And so helping them to build insight, introspection can come through broaching. Avine's model of broaching, it really is multidimensional. So we're going to look at each of the 4 dimensions of it. The first dimension is intra-counseling. This is when the clinician or provider acknowledges similarities and differences, and they explore their interpersonal process within the therapeutic alliance or within the healthcare alliance. So With this one, intra-counseling, it would be if you're a white provider, you would acknowledge some of the differences. Like as a white American, I may not know some of the stigma or experiences that you've had with the integrative healthcare services. But tell me more about that. I'm curious and I want to know more about maybe some of the experience you're describing that make you hesitant to following up with treatment or following up with appointments. Tell me about how you've been treated as a person of color within these settings. And because me as a white American, I may not know what that's like. So that would be intra counseling broaching. Intra-individual is the clinician or provider acknowledging the multiple dimensions of the patient. Like if an individual is, say, Indigenous American, but they also identify as LGBTQ+, that would be me acknowledging how being LGBTQ+ may impact presenting concerns or presenting issues, or may even put the individual at certain risk factors based off the various identities. So it would be me broaching the individual, looking at the multiple dimensions of them. So not just race, but say looking at age or LGBTQ plus or socioeconomic status. That's intra-individual. Intra-rec is the clinician acknowledging within group concerns. So exploring with the patient, like concerns that arise within the group. So if you're working, say, with an African American, acknowledging concerns that may occur, like maybe messages that are given in the African American community about seeking out integrative services. That would be looking at group membership and shared experiences amongst that group, and that's intra-rec, where rec stands for race, ethnicity, culture. Inter-rec is the clinician acknowledging encounters with racism overall, as well as other forms of oppression that may create psychological distress for the patient. So that's inter-rec. So really you can broach using either of the three domains or dimensions. So you may broach intra-counseling, looking at similarities and differences. You may broach intra-individual, where then you're looking at the multiple dimensions, where you're asking questions about what is it like being an African-American, LGBTQ plus individual, that's intra-individual. You may also then broach using intra-rec, where I may ask you questions like, tell me about, your experience as an Asian American seeking out, say, mental health services within the Asian American community. Is it, acceptable to seek out mental health services? Is that okay? Tell me more about that. And then inter-rec, again, would be you broaching and looking at other forms of oppression, even racialized trauma, race-based discrimination that the individual may have experienced overall more globally. Broaching, I like to say, is kind of getting in the soup or getting in the mix with the client or patient. It involves getting curious, asking questions like, how did that feel? What was that experience like for you? How did your family or community respond? What did this mean for you? What was that experience like for you as a person of color or as a person of LGBTQ identity? It's getting curious, it's getting in the mix, and it's allowing yourself to engage in conversations that allow you to understand the client better. So then you can maybe better treatment plan, know risk factors, know the person's full psychosocial history and medical history as well, and get a better picture of what's going on for the individual as it relates to race, ethnicity, and culture. So I encourage all providers in integrative health settings to have a narrative, have something that you can say that can open up the door to letting your patient, your client know that you are going to, and it's okay to talk about race and ethnicity. So this is just an example, sample. It says, to help you understand me and my approach to integrative care better, I like to talk to you more about my cultural background, important parts of counseling for many. These are important parts of counseling for many reasons. I identify as, and then you would just describe how you identify as heterosexual, African American woman, and this may affect how I understand your problem. However, it's really important that I understand the issues you discuss with me during therapy from your cultural worldview as much as possible. And again, you can adapt this to your particular role in integrative healthcare. So if you're not a therapist, you would say, it's important for me to understand your role as your primary care doctor, or as your psychiatrist, or as your nurse practitioner. So you can adapt the wording to fit. How do you identify your race, ethnicity? So you ask these questions: your gender, your sexual orientation. You ask, how do you identify, or do you identify with a particular religious or spiritual background? And you can go on and state during your narrative or your dialogue with the patient. At times, I may ask you how the aspects of your culture influence your presenting problems. Additionally, many people experience discrimination because of their cultural identity, which may also contribute to their difficulties. In these cases, we may also explore strategies to help you achieve a greater sense of empowerment. Do you have any questions? So that's just a sample of how you can open up the conversation. You don't have to use this word for word, but finding something that fits for you as a provider, something that fits with your own individual style. This, again, is just a sample. And so here are some questions that may help you further develop how you're going to start the conversation of bringing race, ethnicity, culture into your treatment process, your services you're providing. And I encourage you to do it early on, having these conversations, because if you wait, then it may come across less than genuine. Like if you've been working with someone for years and you just now start having these conversations, it's like, well, where does this come from? Versus if you're just off the bat having it. So here are some questions that can help you to think about and develop your narrative. How does culture influence the relationship between the patient and the therapist, or the patient and the mental health or physical health medical provider? What are your most salient cultural identities? How would you explain these identities to your patient? So again, you're thinking about these questions of yourself. How would you invite your patient to share about their own cultural identities? In what way does culture influence the patient's presenting concerns? Broadly, how do you conceptualize that? How would you invite the patient to explore how culture influences their presenting concerns? And how would you inform your patient of your intention to explore culture through therapy? So I encourage you to pause this video and take a moment and answer some of these questions, because I think through pausing and answering some of these questions, you may be better able to create your own narrative or your style. Right? So for me, something I do, I don't necessarily use that paragraph that I showed on the previous slide. I have, like, in my office, pictures of my grandparents. And many times when I, disclose a little bit about myself early on in treatment, and I talk about my style, the way I work with patients, I'll use that picture and I'll say, this is a picture, of my grandparents. The reason why I'm sharing this with you is because, my race and my identity as a Black American, that may impact the work that I do with you. That may impact how I see things, and it may cause me to have to get clarity because you may not identify as Black American. But like my grandparents' experiences with growing up in Baton Rouge in the segregated South during the time of the Civil Rights Movement, that impacts how I see things. And I think race and I think culture is important. So sometimes when we're working together, I may, I may ask, how does it feel as a Hispanic American, African American? How does this situation may be impacted by some of your race and your upbringing? And so I may ask you questions like that at times. So that's just me kind of role playing for you all how I may do it. I use the picture of my grandparents to start the conversation and describe some of their experiences of growing up and sharing stories with me around race and racism. And then I go into saying, racism is important to talk about because it impacts and it colors how you see things. How you do it is totally up to you, but I do encourage you to take a moment, look at some of these questions, and it may even spark some other questions for you to answer, to develop your own narrative and approach to how you'll talk about it within your respective setting. So here's an example of just, this would be a mental health example. We'll look at a more integrative health example in a moment. But Michael is a 15-year-old biracial patient who identifies as non-binary using they, them pronouns. Kayla, his mom, was referred him to counseling because she expressed concerns with his basically sexual orientation. She feels he's been influenced by peers at his Performing Arts High School, to engage in being um, non-binary. Michael is angry and frustrated with Kayla, his mom, and this is the conversation that occurs with the therapist. Therapist says, Michael, I understand that your mother, she referred you to counseling because she has concern about your gender identity. Is that correct? Michael says, yes, she thinks I have a problem, but really she's the one with the problem. The therapist says, I imagine things are pretty difficult between you and your mom right now. Individuals with non-binary gender identity don't always receive the support that they like from their families right away. Michael says, it's hard enough dealing with my grandparents. I shouldn't have to deal with this from my mother, too. It's like the whole side of the family has a problem. Okay, so that's the conversation. Now I want you to, again, maybe pause the video or take a moment. I want you to think about how you would respond if you're going to broach this issue of Michael's identities. What would you say next after he said that? Take a moment, think about it. Pause if you need to. It's totally okay. How would you respond to what he just put out there for you? Right, here's just a sample. Again, there's a lot of different right responses. This is a sample I came up with that his therapist could say. The therapist could say, yes, I understand that members of your community face increased oppression and unique challenges because of the intersectionality of their race, culture, and LGBTQ identities. Can you tell me more about this experience? So therapist just broached, that's a broach. She broached, um, tell me more about that experience of your racial, cultural background, and then being a person who identifies as LGBTQ plus. And then this allows Michael to continue their experiences, sharing their experience. So that's a broach. Now we're going to look at an example that would occur maybe within more integrated health. So that was more mental health. Let's look at one that could occur within integrative health with a primary care doctor and a therapist involved. So this is the case of Letitia. Letitia is a 35-year-old SIG-Gen African-American woman seeking services for the first time. She first saw her primary care doctor due to what she described as having dizzy spells. That was later diagnosed as hypertension. She was started on medication to manage her high blood pressure and asked to engage in behaviors to change her diet. Letitia is resistant to starting the high blood pressure medication because she feels the medication, quote, isn't for Black people and will make her have more health problems. So essentially, she's saying, I don't think this medication is really good for people of my racial group, and it's going to make me worse. Letitia also talks to her primary care doctor about feeling stress, and he thought it might be a good idea for her to see a therapist. So Letitia begins therapy talking about issues she experiences at work. At intake, Letitia states, I feel like people skip over me at work and will go around me to get answers to questions I'm qualified to answer. And to top it off, my boss says nothing about the situation. Letitia went on to state, I'm college educated and I still get no respect. Letitia reports a lack of motivation, sadness, hopelessness, and increased sleep as a result of her difficulties. She wants to advance in her career, but does not know how. Let's take the case of Letitia and use the 4 broaching strategies. So as you think about this, think about your own work that you're doing and think about how you could use each of these 4 stages of broaching. So they are joining, assessment, preparation, and delivery. So stage 1. The joining stage is connected to Rogerian theory. So Rogerian theory, the premise behind it is that we have to build rapport. So essentially, in order to take people where we go, no matter what our role is within integrative health, we have to build rapport. We have to get them in the car with us. So we have to build rapport. And according to Rogerian theory, the way we get people in the car is through our genuineness, through our empathy, and through having unconditional positive regard so that we don't judge our clients, that we treat them with empathy and genuineness. So being able to connect Rogerian theory helps us to be able to join, and that helps us to establish a working alliance with the patient. Some strategies you can use to join with your patients. It tells the clinician using the patient's language. So in the case of Letitia, where she says, she's talking to a primary care doctor, she's talking about her concerns with the hypertension medication, we could use the words of, I hear you saying that you feel like this medication isn't for Black people. Tell me, it isn't for Black people. I hear you saying that. That would be using her own words. Or if you're in mental health and you're working with her on the lack of motivation she's experiencing, you can use her words of, I hear you saying you feel skipped over at work. You feel like your boss does nothing to help. Using the client's own words to open up, because that allows for the client or patient, depending on your setting, to feel heard. And for people who are often disempowered or marginalized, being able to feel heard by a provider can go a long way with them retaining services with you. So first step, use the patient's language, open conversation with it. Next step you can do is involve validating the patient's feelings and perspectives and convey acceptance through verbal communication. That could be through your head nods. That can even be through, your face showing like a lack of concern, leaning in closer to the patient to let them know, like, I hear you, I'm here with you, I'm attentive, I'm in the here and now. So those things can help the patient feel heard. Even your verbal communication through paraphrasing back, saying back what you heard the patient say. Because sometimes people of color may feel like they come in to integrative service, and if you're just rushing, like you're just going to the next patient, you're just, checking boxes, like, okay, to get out of there, and you're not taking time to actually communicate and listen and talk with them, that can shut down communication. You won't even get to a point of being able to talk about the issues of race, ethnicity, culture, and what brings them in, because you're missing out on that ability to show up, convey acceptance. Another way to join would be affirming meaning that the patient experiences. So the meaning that you hear the patient saying. So the meaning may be that, there may be some fear with starting a new hypertension medication, and there may be some hesitancy with it because of being a person of color. Maybe there have been bad stories from aunts, uncles, cousins of yours who have tried that and had side effects to it, right? So affirming that, I hear what you're saying. I hear that fear and that that's within you, and also hear maybe that other providers haven't heard your concern, not being heard. So affirming the meaning that you heard the patient saying. The next thing involves verbalization of the patient's strengths and resources. What are some strengths and resources for Letitia? And that could be individually within her or within her community that can help her with some of the physical health issues she's experiencing, as well as the mental health, because we know from an integrated perspective, they work together, they work in tandem, your physical and your mental health. So being able to look for and point out resources, strengths for Letitia will be key. So that's step one, joining. Got to get the people in the car to take them where they need to go. Step two is assessment. At this step, assessment level, the clinician is examining broaching is whether it's warranted or not. Should we do it or not? And there are 6 considerations, according to Dave Vines, that we should look at. First is multicultural case conceptualization. Second is racial identity functioning. Third is relevant intersection identities. Fourth is patient readiness to explore race, ethnicity, culture concerns. Fifth, the strength of the therapeutic alliance, or the strength of the alliance, integrative care alliance. And then 6 is the counselor or provider's self-efficacy. So we're going to take a look at all 6 of these. So the multicultural case conceptualization, this is where the clinician or provider, you want to look at what areas of race, ethnicity, culture are most salient for the patient before broaching. So for Letitia, it seems like race-based issues as it relates to starting the hypertension medication, race-based issues and discrimination as it relates to her workplace. So we want to look at what will we be broaching, and it seems like it's race-based traumas or bad experiences, discrimination that she's experienced within various settings. So we probably want to broach that if we're looking at a multicultural case conceptualization for Letitia. The next is we want to look at racial identity functioning. At this level, the clinician wants to appraise the patient's connectedness to their racial group. So just because someone is a person of color, that does not mean that they connect with as African American, that may not, that you shouldn't just assume that I connect with my Blackness or Black racial identity. Because for some individuals, they may be more connected, say, with white culture, maybe because of their upbringing or trying to fit in, or maybe even because of things like internalized racism, they may be trying to adapt to more white culture or other culture than their racial identity. So we want to assess this for the patient. How connected are they with their racial group or with their racial identity? And for Letitia, it seems like she's very connected because these issues of race are coming up for her as we talk with her. If someone, though, is at the lower end of racial identity continuum, meaning that, say, they're a person of color, but they're really maybe trying to more white ways of thinking, white norms, middle class, white standards, then broaching would not be effective. And there's going to be less, they're going to be less responsive to it if we try it, because their Blackness or their identity as Asian or Indigenous American isn't something they're really thinking about, versus someone who is thinking about their racial identity development, or their race more salient, is going to be a better opportunity to broach than someone who's at the lower end of the racial identity continuum, where race is not as important, or something that's on their radar, or something that they're like talking or about or considering. So again, you want to consider their racial identity functioning. Where are they at on the continuum? Is it salient for them? Is it not? Other relevant intersecting identities. We want to, according to Dave Vines, we also want to look at how other identities. So for Letitia, we want to look at how like their gender identity, their religion, disability status, age, acculturation, social class, or even beauty privileges may be impacting what they're bringing in. So for Letitia, we may want to look at, her age factor. She's 35 years old, relatively young. Could that be impacting even how she's conceptualizing needing to be treated for her health concerns? Maybe she's, coming to grips with the fact that she is, becoming more middle aged, she's getting older. That could impact, how she's seeing her need, or maybe even not wanting to see the need for different physical ailments occurring now within her body because of age. So we want to look at the intersecting identities and how they may be presenting or impacting the presenting issue and working in tandem or in lieu. Next, we want to look at the patient's readiness to explore race, ethnicity, and culture. If a patient is at a time where they're dealing with things such as manic behavior or psychotic behavior or severe physical health concerns, we probably want to work on stabilization before broaching, because they're not going to be able to do the work of looking at the impact of race, ethnicity if they have, say, a very severe physical health going on, physical health issue or ailment going on, or if they're, in a manic state or a psychotic state, their thought process isn't going to be at a state where they can actually do the work. So we want to look at the likelihood that the patient will be receptive to the broach and their readiness. So there may be certain things like the issues I just mentioned that may be stopping the readiness. So we have to assess that. We also want to look at the strength of the therapeutic alliance, or if you want to say the integrative care alliance. How strong or how bonded are we as an integrative care unit with this patient? Do we have the Rogerian principles that I talked about earlier in place? Do we have empathy? Do we have the genuineness? Do we have the positive regard established with the individual? So doing some introspection, thinking about the relationship is important at this stage. Also, we want to look at, the principles of cultural humility, being able to be humble, acknowledging when we don't know things, being able to be humble about our process of understanding how our own identities may be impacting our own bias, may be impacting the relationship. So we want to look at the strength of the relationship from that perspective and how comfortable we are with broaching. Because if we're not comfortable, we don't want to probably then broach, because we're going to create a rupture in the relationship, and it will come across probably also as being less than genuine. Um, so we also then want to assess our proficiency or our efficacy, which is really our confidence in the ability to execute a broach in the therapy session, or again in the integrative care setting that we're in, if we're a medical professional or psychiatrist, nurse practitioner, what have you. So we want to look at our self-efficacy overall. How comfortable do we feel in broaching? If we don't feel comfortable, then this is a great time to seek supervision, consultation. To also, I encourage clinicians who are doing this work, who want to be more multiculturally competent and who want to be able to broach, to read, to seek out resources, training, such as you're doing today, that can get you to a point where you're feeling more secure in your ability to broach. Step three is preparation. This requires the provider to set an intention. So this is before you actually verbalize you're going to broach. You're going to set your intention in your mind and say, next time that patient comes in, I need to ask them. I need to ask Letitia about, why she feels the medication isn't for Black folks. I need to get into her inner world and understand, because then that may help me to provide psychoeducation or education around things and to provide reassurance, to be able to validate, to listen to her. So this is before Letitia, and the example we've been using, comes in. So this requires the provider to set an intention to broach in their mind before they actually do. It involves the provider developing the broach before they again do it. So there's thought, there's premeditation behind it, of what they've observed, what they are going to assess, what they're going to broach needs to be based off of observation of what should be talked about. And then it requires the provider to make a mental note of the areas of oppression in the individual, whether it's colorism, racism, classism, that the patient has experienced, because that will then determine, what the broach will be, how you're going to open up the door to the conversation around the race, ethnic, or cultural issue you're going to talk about. Step four, now we're at delivery. Delivery, you're in the appointment with your patient, and you're going to deliver the broach statement. Once the patient responds, once you broach, so with the case of Letitia, I may broach about, say, her concerns with being on the medication that helps with hypertension. I may say, Letitia, I hear that you have a concern about the medication. You're feeling like it's really not designed or it's not good for Black Americans. Can you tell me more about that? That was the broach. So once the patient responds, then the provider, you don't want to ask any more questions. You want to reflect the content and reflect her feelings back to her so that she can feel heard. And so also, so you make sure that you've understood it, because it allows the patient to be able to correct it if you didn't understand what the concern was in this example. Then allow for silence, like 3 to 5 seconds. So you're going to broach, then you're going to do some reflection of either content or feelings. Don't ask another question. Don't. Okay. And then allow for silence so you can allow the person to process what they just heard themselves say and what you just reflected back to them. Then you're going to invite the patient to share their feelings or thoughts. The clinician should follow up with some reflective statements that validate, and that's important, validate that the patient has said something, and so that this helps them then to feel heard. Then step four, the clinician invites the patient to discuss their experiences, other experiences of oppression and discrimination. So in this example, I was giving an example of being a medical provider or medical doctor. Then I may make connections with, are you experiencing, other forms of oppression or discrimination in other areas of your life? And then Letitia may talk about the experience with work. Step five is the clinician that engages in data gathering to collect information on the patient's racial ethnic concern. So then this will be the clinician with Letitia, or the medical doctor for Letitia, maybe gathering information about what do people in the Black community think about, being on the hypertension medication, what maybe stigma or messages have been given about medication or seeking out medical help or medical services like Letitia is. So you may enlist cultural informants, you may learn more about the population through reading, through the literature, through immersing yourself in activities that help you to learn more about the norm, standards, or what Letitia may be describing as it relates to her concern. And again, I always encourage people to consult. Don't operate in a bubble in isolation. Consult with other providers about maybe what they've heard from other African Americans or other racial minorities as it relates to the issue. The strategies, this is to help the therapist, but it's also to help any integrative care provider. Again, the broaching literature comes a lot of the counseling, so you'll see, therapists, counselors talk about, but this is really for any integrative help, things that you can do as you're trying to work on these broaching skills. If you're enhancing your broaching skills, you want to use mindfulness and self-affirmation and self-compassion with yourself. There's research coming out of Harvard that supports the idea of using loving kindness guided meditation because doing this work around race and ethnicity and culture is heavy, right? Because people are addressing some things that are near and dear to their heart, how they've been treated, racism, discrimination. So we need to show some kindness, some self-compassion to ourselves, and using mindfulness or even affirmations, affirming yourself and sending self-compassion can help you to continue the work versus giving up and say, I'm not going to even broach, I'm not going to even touch the topic. But to send that loving kindness using guided meditations, just group up guided meditations for loving kindness. You'll find some that can help you to be able to work through your own hesitation or bias or even hesitation with broaching. Adapt a here and now mindset. Sometimes, as I stated earlier, we're moving from patient to patient to patient throughout our days. Be in the here and now with your patients. Don't think about the next one. Think about, I'm in the room with this person. They took time out for this appointment to be with me. I need to be here and now. I need to be present, center, and get curious with them as it relates to these issues. Express a commitment to understanding. This is something you can even express to your clients, then your patients. You can say, I'm committed to understanding. And sometimes I may get it wrong. And when you do get it wrong, the next piece is apologize. Cultural ruptures will happen, but apologize. But express a commitment also to understanding and trying to understand and get curious with the patient as well. Validate the client's patient's experience. That's important. And also acknowledge your shortcomings and limits. But don't just stay there with, oh, I acknowledge I have a shortcoming. I don't know a lot about Indigenous populations. Don't just stay there. Do the research. Have conversations. Engage in community events where you can learn more about the culture that you maybe don't know or your shortcoming is. These things can all help with broaching because they can empower you to be well equipped or better equipped to be able to engage in multicultural counseling and services. Another big thing I'm a big fan of is reading. And so I'm going to tell you about a book that myself and a colleague, Dr. Janae Steele, recently published. It actually will be out April 2023. So this book is on Amazon and on Barnes and Nobles. Black Lives Are Beautiful. This is 50 Tools to Healing the Trauma and Promoting Positive Racial Identity. This book is essential to broaching because it provides structured activities that you can do with your patients that can help them talk about things like self-esteem, how they are resilient when they're facing medical or physical health issues. There are also activities in it that talk about how to engage community support. So it's tools that can help with healing trauma, promote positive racial identity, and it can also give you ideas of how you can broach. Next thing is, it's just some added resources for you all. These added resources are articles, scholarly peer-reviewed articles from Dave Vines. She's a scholar within this field, and these articles provide strategies as well as it talks more about the multidimensional model of broaching. So I encourage you to also check out these articles because I think they can enrich your understanding of broaching even further. The last thing, before I get to the end of the presentation, I want to thank you. I want to thank you for taking time to engage in this work because we know that there's a health disparity, a physical health and a mental health disparity amongst people of color, meaning that a lot of times they're not seeking out integrative services or they're not seeking out, the help that they need, and they suffer for a longer period of time. But if they have providers such as yourself who are willing to do the work to be able to broach and to be able to work on being multiculturally oriented, then that can help break down some of the resistance to seeking help. And if you want to ever get in contact with me, this is my contact information. It's drsharnewton.com. As I said, I do these presentations for universities, for integrative services, also for private practices. And I would love to be able to work with you if there is ever a need in the future. So that is my contact information. I thank you for your time and appreciate you all. Thank you.